Our Impact 5 coverage on autism, connecting the pieces. New numbers out tonight suggest autism is an ever-growing health crisis for our country and beyond. The Centers for Disease Control say autism rates jumped by 30% between 2008 and 2010 alone. Autism statistics suggest the developmental disorder now impacts one of every 68 children, up from 1 in 88 just 2 years earlier. Bob Wright, co-founder of Autism Speaks, with his wife Suzanne, and also the former chairman and CEO of NBC Universal, joins me live. Our audience knows that you and your wife are pouring a lot of effort into your grandson, who's on the autism spectrum, but is also, over what's going on a decade now, pouring a lot of effort into Autism Speaks. First, to the numbers. Do you believe they're accurate?
Well, they're very consistent with the way the CDC has been doing this for the last 15 or 16 years. So there's no reason to believe that they're not accurate. But that methodology, which looks at records and it looks at people that have been diagnosed, still leaves out large areas and large communities where there's very little diagnosis and there are no services. So this number is just going to get, this is a good number against the methodology they're using, but I think the real number is closer to 1 in 40, and this is over 2% boys, even on this finding.
Which leads to the next question. Science or better methodology driving the numbers? What are we looking at as a mix of what you think is driving this? Some suggest it's just better reporting.
Well, you know, in the end, what difference does it make?
Right, exactly.
The reality of it is more awareness, and we'll take some credit for that, building that up. It is more diagnosis, better diagnosis, but that can really, when you get through that, you can only explain about half of it. We're left, as we have been in other periods, with at least half of this increase is not explainable on a historic basis. So that means there's an environmental factor. There's a triggering factor here with existing genetics. This is the difficult part.
Which, Mr. Wright, leads to something that you've pushed on for so long now, you and your wife, and that is the need for more focused research and funding. And if ever there was a clarion call for this, we would think it would be this. Talk about that.
Well, this is exactly it. This is sound the alarm. What more do we need? We've been seeing these numbers. People know they're there, and we're still stuck with the same amount of research that we've had for several years, and we have trouble even keeping that up. It's not nearly enough to deal with this. We have whole communities that don't have services. We have areas where diagnosis is still very hard to come by. There needs to be an emotional response in the form of government to deal with this, as opposed to a defensive response, or we don't understand it. It doesn't make any difference whether you understand it, it's here.
And do the research to help us understand,
right,
push back those frontiers.
And services. And these people are going to be adults. They're going to live a full life.
So it's not only research, it's support services, it's education and the like, the whole gamut.
Early education, diagnosis, and research, scientific research. We need it.
Mr. Wright, co-chairman of and founder of the Autism Speaks organization, you've done more than your lion's share of work from here to Washington, knocking on doors and demanding more effort. I know you and your wife continue that work, and we thank you for it.
More than 2% boys, unbelievable.
It certainly is. The numbers are daunting, to say the very least. On WPTV.com, we have a page